health insurance is so expensive right now because insurance companies aren't really competing. People just buy insurance based on how expensive it is. And this means a lot of younger people who are healthier aren't buying insurance. Insurance companies are therefore more responsible for more risk. The chance that they'll have to pay for someone's treatment. There's a lot of older people who are more prone to getting sick that are buying insurance because they need it. And so insurance companies have to pay a lot more for them. The problem is there aren't enough younger, healthier people to bring prices low enough for younger, healthier people to want to buy insurance. So this is why the Affordable Care Act sets up exchanges where insurance companies compete with one another for consumers, kind of like a farmer's market. And another piece of that is you need more consumers. So what does the Affordable Care Act do? They set up an individual mandate that says you must get health insurance or pay a fine. And I know that sounds really harsh, but this fine is either calculated in terms of a certain sum or a percentage of your income. Another thing that the Affordable Care Act does that makes health insurance affordable is determining whether individuals are eligible for subsidies based on their income. The Affordable Care Act has a lot of potential to increase coverage for a lot of people. At this point, younger, healthier people are the people who are most likely not to have insurance. This means that they're not getting access to preventative care. But if you think about it also, for people who can't afford health insurance right now, these people are being sent to the emergency room instead. And by that time, it's often too late. But a problem with the Affordable Care Act is that it also has the potential to be very costly. If not enough people buy health insurance through the state exchanges, which will be set up in 2014, the part about spreading risk and lowering health insurance costs doesn't happen if there aren't enough younger, healthier people joining that. The federal government also has to spend a lot of money on those subsidies and then the administrative costs of implementing those subsidies. As weird as it sounds, even though Obama was the one to come up with the Patient Protection and Affordable Care Act, I think we can learn a lot about implementing it from Mitt Romney. So once upon a time in Massachusetts implemented universal coverage. It increased coverage from 91% to 97%. That's only 3% of people not covered in Massachusetts at this point. And the way they did that was also by implementing an individual mandate, saying you have to buy health insurance. But instead of making it about the fine and what will happen if you don't buy the health insurance, they made it more like a social norm, like wearing a seatbelt. It's something you should do because it's right and it's good for you. And everyone bought into it. The Boston Red Sox announced it. In the pharmacy, loudspeakers told people about it. There were hospitals and community organizations that came together and said you really should get covered. And a common comment from young people about coverage, I bought health insurance because my mom said I'd get in trouble if I didn't. And it worked. I think the key to making sure that the Affordable Care Act is successful and coverage is made affordable because of it is education and awareness. If you like this video, please subscribe to 365 Nerd, and please leave a comment telling me what you liked about this video, any questions that you might have. I'm Karen, I'm a graduate student studying social work. Bye!